I'm Emma Lubitsch, and you're watching CAN TV. We're here today with Sage Kim, Associate Professor of Health Policy and Administration at UIC School of Public Health, and Robin Fretwell Wilson, Director of the Institute of Government and Public Affairs. So thank you both for being with me today.
Thank you.
Yeah, so your research team released a report on June 30th titled Pandemic Behind Bars, Containing COVID-19 Outbreaks in Illinois Correctional Settings. So the report details the ways in which correctional facilities are hotbeds for COVID-19 and how that then impacts incarcerated communities as well as staff and therefore communities surrounding. So let's start at the beginning of the report. So the report notes that, quote, at 12 of IDOC's 24 correctional centers across Illinois, 274 inmates had tested positive for COVID-19, of whom 225 had recovered as of June 22nd. The most recent information publicly available indicates 13 had died as of June 9th, end quote. So these numbers are from several months ago. So do you have updated data as to how infections have risen or fallen since the end of June?
Yeah, it looks not that great. Now IDOC reports that more than 1,300 inmates, COVID positive, which is almost like quadrupled since June. Our report came out. And not only that, I think that number of facilities affected by COVID also increased. So initially we reported there are 12 IDOC prisons had COVID positive cases, but now it looks like 19, prisons plus some, processing treatment programs. So the situation is not, improving compared to the end of June.
And so the report notes that IDOC facilities are not required to report the number of tests performed, but only the amount of positive cases that are recorded. So how does that shape our understanding of how the virus is impacting these facilities? I mean, what were the testing numbers like at the time the report was released? And is this still the case today, even with increased testing across Illinois?
See, I don't know if it's required or not required. What we know is that IDOC doesn't report official number of tests performed. So we can only guess and estimate, from multiple reports and interviews that IDOC spokesperson had given. So what we know is that the end of June, one of the, sort of report came out and saying IDOC did like about 1,000, just shy of 1,000 tests performed. But then now, like early September, sort of national level reports show that there's like about estimated 8,000 tests have done. So they improved testing a lot, but still it means, about 25% of inmates got tested, right? So that's way below the Illinois general population. The other concern is that when we reported this initially, the positive rate, according to IDOC, was about 30%, right?
Oh, yeah.
Of those people who got tested. Now, if we think about tests at about 8,000 and there are 32,000 inmates now in IDOC prisons. So still the positive rate is, greater than 16%. You can compare that with Illinois positive rate. We went up to like 4% recently, but it came down to like about 3.5% now. So still the positive rate in the Illinois prisons is way, higher than the general population.
Right. And so something that you focus on in the report is that incarcerated communities are not isolated from the rest of us. So when there are COVID outbreaks in prisons and jails, it impacts all community members. So, quote, a study published in journal Health Affairs documents that 15.9% of all confirmed COVID-19 cases in Chicago on April 19th were associated with cycling through Cook County Jail. So meaning that arrest and pretrial detention practices may be contributing to disease spread, end quote. So That's a pretty remarkable finding. So talk about the ways that the virus spreads to communities from within carceral settings and then vice versa.
Well, I think that what we actually said was, this particular article talking about the impact of Cook County Jail affecting the COVID rate in the general population in Chicago. But there's a lot of issues with the article, because we find the data that they got, we actually got the same data up to June, and it doesn't pan out the way, aside from somebody else's study, right? I don't want to, talk about, this particular article, but what we actually mention, what's important is that the prisons and jails in Illinois are not, isolated, sort of siloed, contained facilities, people constantly moving in and out, including officers and staff who live around jails and prisons. And so I think that, and the other thing is that usually, correctional settings tend to receive people of high risk, right? So, and hard to, usually people call it hard to reach population. So chances are they will receive people with, like high risk of COVID, when overall Chicago or Cook County have high rates of COVID. So they will be affected by general COVID's, transmission in the general population. But also, what happens in jails and prisons, actually they're carrying that increased risk back to the community, also staff, officers too. So there's this constant, sort of moving between the population and incarcerated population. So we can't really think about jail inmates, detainees and prison inmates as if they're completely out of the general population. So the going in, sort of a idea is that we really need to take into account and sort of consider what happens in correctional settings to be able to actually manage and mitigate overall COVID transmission in our community. Same thing with nursing homes, and same thing with meat packing. Well, now we're actually dealing with schools opening and universities, and you can see already university towns actually being affected by what happened in university setting. So same sort of fundamentals applied to jails and prisons. And we really advocate not thinking about inmates and detainees as if they have less rights to be healthy. So Robin probably had more to say.
I was just going to add a couple of little points about that, Emma. So one, we re-released the report, updated it with actually data from Cook County jails that they provided to us on July 6th. So when you go to click on that link at the IGPA website, you'll see that. And one of the miracle stories is that Cook County was actually able to tamp down what was a raging epidemic. And to their credit, partly by doing exactly what Sage said. They recognized that they had specifically high risk, hard to reach populations coming in the door. So they started testing, screening, and pushing people, to the side if they tested positive as they were coming in. And I think that's an important story to be told. I think the second thing that's useful to note is that the specific study that Sage is discussing has kind of caused reverberations out in the world, and there are a lot of academic researchers that are not confident about the methods. Now, at the time that we were writing about it, those kinds of critiques we note in a footnote, we acknowledge them, and to some extent the discussion of Cook County was almost a side note. It was to say that there are questions that will affect detainees just as they were in fact affecting the inmate population. The inmate population is much more stable. In fact, people haven't been being released really, and there are a set of, lawsuits just about that. Like, should we be doing more early release? And for the moment, those seem to be kind of in a holding pattern. One of the things that we tried to emphasize at the moment we were writing is there were so few tests available, it seemed, within IDOC. And you go, oh my God, how can that be? There are so many people there that surely we have more tests. And I think that's one of the problems with the way IDOC is doing the reporting. They're telling you how many tests that are available to them across this incredibly large population, but they're not telling you how many people have been tested. And those are very different things, right? And we were hoping that maybe looking at the facilities, the aggregate population versus this sort of static number of tests that they report on their website might motivate people to realize, wait a minute, we can't wash our hands of the inmate population. We can't go, oh yeah, that's like some people over here. Because if people are coming into those facilities to work and returning to their homes, they're not isolated islands, as Sage just said. In fact, they're part of our communities. And we don't always think about that. We do think about nursing homes, right? Because your mom or my dad is in that facility. We don't always think about the inmate populations, or facilities that are in our own community. So we were hoping that we could humanize this problem and kind of, it's always sloganized right now that we're all in this together, but we are in fact all in this together. And I think, it kind of drew that out. That was one of the things that we wanted the policy spotlight to really hit. We have since started a journaling project, where another co-PI of mine, co-principal investigator of mine, and I have been reaching out to people who are recently released and people who are still in IDOC facilities. And some of them are in large dorms, and they're supposed to have the ability to be able to wash their hands and do things that the John Howard Association has talked about. And it's not looking like that's working flawlessly inside. So we also were hoping to kind of give a peek inside of these places that are essentially black boxes to us.
But the other thing that I want to say, the importance of knowing how many tests were done, right, is that, even Cook County Jail people acknowledged that one of the method that they were using, very successful, was be able to implement rapid testing in jail, which became very successful. Well, but even with that, early July, they only had like 14 people actively isolated. Now it went up to, 46. It doesn't look too bad, but still, the number's not going down from 14 in July. It's actually going up, which may mean it's just reflecting what happened in Chicago, but their positive rate, CCDOC reports that it's up to like 6.8% now. So.
And so you detail the lack of adequate healthcare in IDOC facilities even before the COVID-19 outbreak, which then led to a consent decree in early 2019. So can you talk about that and then how IDOC's track record is in adhering to the consent decree?
Well, let me, I did a piece of this, part of this part of the report, so let me take a little stab at that. The consent decree is actually a nice thing in the sense that, the facilities themselves recognized that there was a need to make some reforms so that people were well. And it's in the interest of the state for people to be well within these facilities. In fact, we have a legal duty of care to people who are in the special custody of the state to make them well. And so certainly this is true of the inmate population. After the monitor was put in place to look at lots and lots and lots of things, some of which are specifically healthcare focused, There was a first report that was released in November of 2019. So the first cut 6 months after the consent decree, looking at how it's going. And there were some things that with 2020 hindsight in the pandemic, we realized, well, wait, it'd be really important that these things be true. Okay, immunization, screening, those are actually parts of that consent decree and the very detailed protocols for what we should be doing. Obviously, in a pandemic, we need to be doing that. There were actually points made at the 6-month mark about the fact that they needed to be doing what are called mortality reviews. Like if somebody passes away, was it that we kind of slow walked their cancer treatment? I think 6 months before the pandemic, we were worried that was what was in fact happening. And sometimes, you know, the process for approving intensive healthcare services was what gave us the consent decree in the first place. So there were some structural changes as a result of that. But now with 2020 hindsight, you think, wow, we should be checking at what's happening with the 13 folks who passed away. Was there anything we could learn from the fact that they passed away during this period of time that would help us keep other people in these facilities well and keep, frankly, the staff at these facilities well? So we know that didn't happen. John Howard Association, I know you know their work, and they've done amazing work just kind of peeking inside of these facilities and trying to figure out what the experience of real people are. And they took a survey look at this at the end of April and the beginning of May, and they were finding that less than just about a third of people said that they didn't have enough soap to wash their hands regularly. And, you know, I think when we think about, you know, facilities, we're thinking, oh, we're going to what, throw all the tests there? No, how about like we just have soap, right? Or the ability to clean your own cell. And so, you know, John Howard found that nearly half, 46% of the folks in IDOC facilities didn't even have the cleaning agents to clean their own cells. The duty's on them to clean their own cells, but you have to give them something to do that with.
So to add to that, we actually follow their, you know, IDOC inventory, looking at number of soaps and, you know, hand sanitizer availability. It seems that their supply, you know, seems to increase dramatically. And the other thing that when the John Howard Association had the survey and then they actually gave IDOC a chance to respond, and they were talking about, you know, how many soaps, you know, like they were providing weekly basis, you know, soap to inmates and things like that. But then, you know, even in September sort of interviews with John Howard, you know, IDOC effort may, you know, not enough to you know, address the current issues. But then at the same time, IDOC and IDPH actually had a joint statement saying we're working closely to address this. So, you know, obviously, what?
And that was in September?
Yeah, so early September, there was a joint statement between IDOC and IDPH. So obviously there's a, you know, organizational level, institutional level effort to really coordinate to address that. But at the same time, you know, sort of advocate group like John Howard find from, you know, individual inmates, you know, saying that it's not enough. So you know, there's always tension there, but
you know, Emma, I'll just add one little point about hand sanitizer. I didn't realize you could use it to catch things on fire, but apparently, I
didn't know that.
Yeah, you can use hand sanitizer to like make, you know, little pyrotechnics, which obviously you want inside of a jail. But one of the things that we're seeing and what's coming out of Cook County is that they've suspended the prohibition on hand sanitizer. Mm-hmm. And one of the things I was really intrigued by in the policy spotlight that we did is the public-private partnerships to try to get hand sanitizers into the jails. I mean, it's really inspiring. The Illinois Coalition of Higher Education and Prisons, which does prison education, like was actually collecting stuff from people in the community to try to get to inmates. And you know, at this time when we're so fractured as a society and like so polarized, it just stops you like in your tracks to realize people really are trying to help. And it's great to see the state, you know, taking both of these lead agencies and saying, wait a minute, even on this small basic, like we all take for granted thing like soap, we have got to focus and get this to people.
Right. And so let's talk about some of the solutions you proposed for tempering the spread of the virus in correctional facilities. So you identified in the report 3 essential things that need to happen. So 1, attending to basic public health needs, 2, limiting transmission by reducing population, and 3, maintaining ties. So can we talk about each of those strategies?
Yeah, I want to talk about this reducing, you know, IDOC population, because I think to me it's really important. But you know, you tell me, I don't know what to make of this. So when you look at the IDOC population, the end of December, so it was just before COVID, there were about 38,000 people in IDOC facilities. If you look at the latest, which is like the end of June, now it went down to 32,000. So that means there are about 6,000 people less in IDOC, which is not, enough to, I don't know, enough to make a difference, maybe. But it is a good chunk of number, 6,000 people, right? On the other hand, Cook County Jail, I mean, one of the reasons why they could actually reduce the number is because they stopped receiving anybody from that too. Changed now. All, you know, by the end of August, now they're receiving people from jails. So, you know, there's a little bit of decrease, but if you look at Cook County Jail population, you know, when we reported in July, the census was 4,600, and now it's up to 5,300. So it's going up. So actually, if it is, you know, 5,300, you know, over 5,000, it's actually back to before COVID number. So the number is going up. We know that there are a lot of things going on in the society. So we, you know, the CCDOC may not be able to, you know, dictate how many people they receive, but so there's that. One concern that you know, I was reading, you know, reports and things, and you know, one of the reports actually talking about who's actually getting released, right? And so they address, you know, again, there's this racial, you know, disparity in terms of who, you know, what percent of African American inmates get, you know, out of IDOC versus, you know, white inmates. So that's probably something that we need to pay attention to. You know, okay, so we reduced IDOC population by about, you know, 6,000. Who are those people? Like, what are the criteria, right? In fact, the proportion of people who are 65 and older actually went up. So I don't know what the metrics of making decisions about those.
Well, I'll just say that, you know, Sage is right. There are a growing number of people in IDOC facilities that are over the age of 50, which is a risk factor itself for coronavirus, and that's quadrupled over a period of time. So we do have to think about vulnerable people medically, especially at risk, vulnerable folks who are in care. And there's been a class action lawsuit, but I believe that it's still a kind of a stall about trying to release prisoners early for their safety. Other states have done that. You know, Rikers had a number of people released. Ohio released 300 inmates in a week after doing massive testing. What it seems to be, though, is if you think about the prison population as like a stable box, you could think about releasing at this end. What Illinois did was almost the opposite of it. It tried to freeze at the front end and keep stable for a period of time what was happening in that population. And I think, they had a gargantuan task on their hands. So many people trying just to freeze frame for a moment and see how do we get, this risk, especially, in places that did have outbreaks, huge outbreaks like Stateville. How do we try to get our arms around that and contain it? Trying to contain the number of people does do that, although we took a different strategy at the front as opposed to the back, as other states did.
Okay. And so the report was completed at the end of June, and you noted that some updates were made in July. But overall, so what are conditions like today? Do you think that your forecast of the situation overall would be an improvement, or have we seen conditions worsen? And does your team have any plans to update the report now that, we know that COVID-19 will be a part of our life for quite some time?
Well, I'll say one thing, just that's come out of the journaling project that we're doing, where we have former inmates and a person in jail now, in an IDOC facility now. Think about how all of us during COVID have struggled with loneliness and isolation. And then imagine that we can't have in-person visitation. We've got to get ways for folks to be able to call out and virtually be in touch with their families. I was talking to somebody this morning, and one of the things that they were saying, it's their birthday today, that they were going to see their mother for the first time in how many months. Think about how every person, we talk about that now. And then these folks have no way to really be in touch. I think we really, really have to think about that. And I think it's important for their mental health to maintain ties. And one of the big difficulties for us in that release process, right? When we were talking about the box being contained at the front and at the back, it's hard to release people if they don't have a place to go. And it's hard for them to have a place to go if they lose those ties to their families. It's just common sense. So we need to do better in terms of making it easy for folks to stay in touch with their families.
I think that COVID actually revealed, the worst, conditions of our society, and also, weaknesses that we can address. And with COVID and Illinois prison systems, we've known that their healthcare conditions is not that great. But now we see, how that may affect when something happened, right? So I'm really hoping, this COVID, 2020 will be, sort of a defining moment that we can actually make, great changes. And I'm on a city racial equity task force, and one of the Illinois IDOC representative actually gave us sort of overview of what IDOC is doing yesterday, and I was really encouraged that IDOC is really focusing on how to pulling data from multiple sources and sort of be able to speak and predict and forecast, prepare. And with this IDOC situation too, one of the issues that we had a lot of trouble actually getting the report done is lack of data and transparency, right? So I'm really hoping that COVID, we can make this unfortunate opportunity produce something good, right?
Did you have any last thoughts you wanted to add?
Well, for me, just to thank you for covering it, because I really do think we lose track of the humanity of each other sometimes. Think about the scarcity of those tests, and where are we going to direct them? Well, we need to direct them to the hospitals, of course, and to first line workers, but we can't forget folks who have not the ability to do for themselves right now. We just can't. This is a porous line, the walls of that prison are porous, and what's happening inside can affect the outside, and what's happening outside can be carried in. So we have to be, it calls us to our common humanity.